God, baby, what are you doing to me?
Oh, hello. I didn't see you there. I'm Scott Fox, lifelong insurance nerd. Now, before we dive into late enrollment penalties and special rules such as IRMAA and late enrollment penalties, Medicare just announced the 2026 cost increases. So let me give you the quick rundown on what you need to know. Feel free to drop your questions in the comments so I can cover them during the Q&A. And if you're watching this on replay, you can still ask questions. I answer every question personally. Okay, so let's take a look at the 2026 cost increases. So, Part A is your hospital coverage. In a nutshell, it's your rent for hospital stays, as well as skilled nursing and hospice. Most people pay nothing for Part A. It's free if you or your spouse worked 40 quarters. It was paid by your Medicare tax contributions. But the deductible jumped from $1,676 in 2025 to $1,736 in 2026. That's up $60. And remember, that's per benefit period, not per year. So multiple hospital stays in a year means you pay this deductible multiple times. My first nerd tip, if you're looking at all these numbers on the screen and you're stressing out because you're new to Medicare, Medigap or Medicare Advantage plans are designed to fill in all of these gaps. So check out my other videos on my channel to see how these work and which one might be right for you. So Part B is your medical coverage, doctor's visits, labs, x-rays, things of that nature. Your Part B premium went from $185 in 2025 to $102.90 in 2026, which is up $17.90 per month. The Part B deductible increased from $257 to $283, which is up $26. If you're a higher earner, IRMAA kicks in at $109,000 for singles, which is up from $106,000 last year. And for married couples, it's $218,000. Now that's based on your income from 2 years ago. And we'll talk more about how IRMAA works later. Part C, or Medicare Advantage, about 3/4 of people with Medicare Advantage plans pay zero premiums. But the average max out of pocket jumped from $5,000 in 2025 to $5,900 in 2026. And I should say the average max, not the maximum allowed. So my next nerd tip is these plans vary wildly by state and even zip code. So your mileage may vary. These may or may not apply to your personal situation. Part D drug coverage. According to CMS, the average premium dropped from $38 to $34.50, but many people are seeing big increases. The standalone Part D deductible went from an average of $590 to $615, which is up about $25. But the real story is Advantage Plan drug deductibles exploded from $39 in 2025 to $420 in 2026. Now, That's the Inflation Reduction Act, shifting costs back to the insurance companies who ultimately pass them on to you. Part D, max out of pocket, increased from $2,000 to $2,100, which is up $100. So the bottom line, costs are up across the board, which is not a surprise. They go up every year. But about 9% on premiums, 2 to 5% on deductibles. To me, the key takeaway here is to look at your ANOC, or your annual notice of change, and make sure that the plan you have is still working for you. Now, I'm not a big advocate of changing just for the sake of changing, but with how volatile the market is, it's a good year to make sure your plan hasn't changed too much. All right, let's move on to more good news and talk about those penalties. Now, nobody likes penalties, but understanding them now could save you thousands later. Today, we're going to talk about the costly mistakes that can follow you for years. All right, let's get nerdy. Question 1. What triggers late enrollment penalties, and how much do they actually cost? Penalties are the Medicare program's way of encouraging timely enrollment, and they can be steep. Part B penalties add 10% to your premium for each 12-month period that you delay, and it's permanent. For example, if you delay 3 years, you're paying 30% more on your Part B premiums forever. Part D penalties are 1% per month that you delay. That adds up quick. So a 24-month delay means 24% higher premiums permanently. Now, my next nerd tip, the penalty most people don't see coming is actually the Part D drug penalty. It applies even if you don't take medications now. Many healthy people skip drug coverage. Then they get hit with penalties later when they need it. So if you're not on any meds and are considering going without a Part D prescription drug plan, get the cheapest one you could find so you don't pay the penalty later. If you have creditable drug coverage elsewhere, always get that confirmation letter and keep it. All right, question number 2. How does IRMAA work? So IRMAA is Medicare's income-related monthly adjustment amount. It's basically a surcharge for higher income folks. If your modified adjusted gross income exceeds certain thresholds, currently starting at around $109,000 for individuals, $218,000 for couples, you'll pay extra for both Parts B and Part D. But here's the good news. You can appeal IRMAA if you've had a life-changing event. These qualifying events include retirement, reduced work hours, marriage, divorce, death of a spouse, loss of income-producing property, or loss of a pension. So my next nerd tip, Medicare looks at your tax return from 2 years ago to determine IRMAA. So your 2024 tax returns affects your 2026 premiums. If your income has recently dropped, file the form SSA 44 right away to request an adjustment, and you could get out of those penalties. All right, question number 3. Which enrollment deadlines are most critical to avoid penalties? If you're turning 65 soon, Your initial enrollment period extends 3 months before your birthday, the month of your birthday, and 3 months after your birthday. Missing this 7-month window triggers penalties unless you have qualifying coverage. For those with employer coverage ending, remember, your special enrollment period is 8 months for Part B, but it's only 63 days for Part D. So my next nerd tip, the fastest way to check your risk is visiting medicare.gov and using their eligibility tool, or call Social Security directly at 800-772-1213. Don't rely on what friends or family tell you. Rules change, and everyone's situation is unique. You could also reach out to me if you have any questions.